So my name is Gaurdia Banister. I am the Executive Director of the Institute for Patient Care and also the Director of the Yvonne L. Munn Center at Massachusetts General Hospital, which is located in Boston, Massachusetts. So I received a bachelor's in nursing science, a BSN in nursing, and I received that back in 1980. I've had an incredible career and an incredible journey, and I always say I have such gratitude for my undergraduate work at the University of Wyoming because it just made such a difference in my life. So when I left there, I knew that I wanted to be a psychiatric mental health nurse. So my first 2 years as a clinical staff nurse, I worked in an acute care locked psychiatric unit in Denver, Colorado. Then I decided, because it had been instilled in me, the importance from the University of Wyoming to advance my education, I went on to get a master's and a PhD in psychiatric nursing with a minor in nursing administration. From that, when I finished, and my career took some twists and turns, I wound up actually being an employee assistance counselor for a few years and manager. But then I left because I wanted to work more closely with nurses and in nursing. So I became the director of a behavioral health program where we had a continuum of addiction treatment services from inpatient detox to rehabilitation and outpatient. And we also had an acute dual diagnosis psychiatric unit. So I was the director of that for about, I guess, 7 or 8 years. And then I went on, and this was at a community hospital in inner city Washington, D.C., caring for the underrepresented, poor, and the elderly. I became the chief nurse of that hospital, which was an incredible, incredible experience. And I just learned so many valuable lessons. And then from there, I left to take this position on at Massachusetts General Hospital as the executive director. And it's been, again, an amazing journey for me. So my day-to-day is really interesting because it's one of these positions that I just have to say that I work with incredibly talented leaders and staff. So much of the work is not necessarily that I do hands-on, but I help to oversee. So as part of the Institute, and we have in nursing and patient care services at Massachusetts General Hospital, probably about 6,000 to 7,000 staff. So I oversee in my institute role, clinical and professional development and the importance of lifelong learning. So we're offering educational programs for all of our constituents. I also oversee a Center for Innovation, and we're always looking for opportunities with our staff in terms of how we can make care better, more efficient, more cost effective, because we know that frontline clinicians, we know that they are faced with clinical challenges in care delivery, but we also know that they have the best answers, the best solutions, the best way to solve some of those issues. And then there is another center, it's called the Blum Patient and Family Learning Center, where we make sure that our patients and also their family members, as you know, as nurses and certainly in healthcare, we speak a very different language than what our patients know. And we want to make sure that our patients and families are equal partners with their providers. And so we provide lots of information for them. And we also are very sensitive to health literacy issues. And then lastly, in my role of also overseeing the Yvonne L. Munn Center for Nursing Research, it's all about creating and advancing an environment of inquiry. We know that nurses, as I said earlier, not only do they identify problems, but they have questions about patient care. And we want to help them by providing the support, because oftentimes when nurses may hear the word research, it may be a little bit daunting to them or a little bit frightening. We want to try to demystify that process and provide resources to help them to answer their research questions. So I have this wonderful opportunity to be able to practice in all of these different spheres. So whether it's education, whether it's practice, whether it's research, whether it's innovation, or whether it's supporting our patients and families, it's a very interesting day that I have, and each day is very different. I am so excited about many, many things. I would say again earlier, it's working with incredible clinicians and incredible leaders who are so smart, so gifted, and so talented. And working in an organization such as Massachusetts General Hospital, it is so committed to providing exemplary care to our patients and families out in the community, to underrepresented populations. So there is this mission that we have of patient care, education, research, and community, where we want to give our very best to anyone who comes in through our doors. I also think what excites me is the fact that there's so much diversity in what I do. So as I said earlier, each day is a little bit different. I wind up, instead of being a specialist, I'm a generalist, and I have my hands, or I'm involved in so many different things. So that makes each day a lot of fun, a lot of fun. I think the most challenging part of this position is that there's so much work to do. I think that nurses, we like to get things done, we like to work hard, and I know that there are just sometimes challenges. We're certainly in the midst of this pandemic right now, and we want to make sure that we're providing the best care possible. The science keeps changing, and so it's just trying to stay abreast of all of the explosion of information, the explosion of science, so that we're delivering the most evidence-based care that we possibly can at any given time. My pieces of advice are: one, be open to the possibilities. As I said earlier, I had no idea that I would look back on my career and have so many amazing experiences. I actually never thought I was going to be in leadership. I never thought I was going to move around to several places to practice. And I certainly didn't think I was going to wind up at a Massachusetts General Hospital, one of the premier organizations, not only in the United States, but also in the world. So I would say be open to opportunities that may come to your door, because I think sometimes we want to make a decision about our career, but it's not always as straightforward. I would also say look around you and look at other leaders, other staff or colleagues, and learn from them. I've tried to, in every environment that I've been in, and I absolutely believe in lifelong learning. So I am always, no matter what age I've been, always trying to learn something new every day. And then lastly, look for mentors. There's so many wonderful, incredibly talented people who want to give back, who want to support others, who want to see the success of others. So find not only one mentor, but many mentors that can help support and guide you through your career.